If you think corporations bought free speech before, now that they're human,
welcome to the Alliance for Democracy's The Populist Dialogues. I'm your host, David Delk. I'm president of the Portland chapter of the Alliance for Democracy. Our guests today are the producers of a new documentary called The Healthcare Movie. Our topic is the movie and the American healthcare insurance system. So I want to welcome Terry Sternberg and Lori Simons.
Yeah.
Great, good. So thank you both for being here.
Yes.
So what motivated you to make this movie?
Well, I'm Canadian, and I grew up in Canada, and Terry came up to Canada in 1982, and we got married, and he lived there for 10 years.
Yeah.
We had 2 sons born in Calgary, Alberta, and then we moved to the United States. For Terry, we moved back to the United States in 1992.
When we came back to the U.S., we had several experiences where we needed to decide whether we needed to get medical care or not. Well, one was an accident with our son, and to go through that process of having to decide whether, it's bad enough to go to the emergency room, whether it's bad enough, whether it's bleeding enough, that was our experience, and it's. We decided, at some point that somebody had to start telling the American people, about what it's really like in Canada, and that you really do have that peace of mind. It's not a myth, that there's peace of mind when you know that your health is taken. You don't have to worry about health care and health insurance.
Right.
And meanwhile, we were also hearing people say a lot of things about Canada that were not any kind of match for our experience, and we were like, well, which Canada are they talking about?
Yeah.
Yeah.
They were saying, you don't want to go to Canada. The care there is terrible, and it's. I don't know where they got that idea. That you have to wait long times. Never was our experience, and so many years passed actually before we came to the point of deciding to make a film.
Okay.
It was 2009 when we started on the film.
And your 2 boys were born in Canada.
They were.
born in Canada.
The experience there, you weren't worried about health care or being able to afford it?
There was no dollar sign equated with doctors in any thought bubble we ever had. That was the part that's so hard to explain to Americans. You think about, do I have time to go to the doctor, or is that appointment convenient for me? But you don't ever think about the cost. There is no cost.
Yeah.
Hospitals and doctors.
Yeah. And of course,
It's not an issue.
just very recently, watching the national news, there was a story about the cost of giving birth in the United States and how varied it was depending on what hospital it was.
Exactly.
Even within the same city, it might vary dramatically.
Right.
And so they were advising for expectant mothers to do their research. So
Just
you
as
would
if
never
you
have
need-
that conversation.
You need
when
something
you're-
else to worry about,
Right, exactly,
right?
right, yes,
Yeah.
right.
Well, you have to pick out your doctor in Canada, and you can pick any doctor you want. So that's a piece of research you have to do. But the idea that it costs something to have a baby is like unbelievable to Canadians. We just talked to some folks that spent $9,000 just for a typical birth of their baby. How can young people afford that?
Yeah, right, yeah.
Wow.
Now, unfortunately, we ask that question so often about young people, how can they afford that? But in so many different situations, whether it's healthcare or housing or school education and so forth, it's like all of these costs have gone astronomical.
That's right.
So,
Yeah.
but we don't need to get off of our topic here.
That's true.
Yeah.
Right, yeah.
So,
yeah.
so just to finish the answer,
Yes.
what motivated the movie, because of all these things that were being said about the Canadian system that didn't meet our experience, we became more and more distressed by that. And it was, I guess it was 2009 at a party we went to with some friends. We were having this discussion about healthcare, and I said, somebody ought to make a movie for the American people about the Canadian healthcare system. And our friends there said, well, why don't you do it? And so we kind of said, what? But we decided to go ahead and do it, and
And so you had experience already of making movies, or
That's a good question.
Well, the
Yeah.
backstory of that is when our oldest
Yeah.
son went to high school, he started getting interested in film production, and that re-triggered an interest that had always been in the back of my mind. So I started making films with his help, and then when he went to college, I went to college. So I studied how to make TV episodes and news magazine type stories. And so I had been making a number of short films. This was the first feature film
I
that
see.
we did.
Okay, all right. And this is like 65 minutes long?
65
Right,
minutes.
Right, yeah, right. And I think you brought the trailer, so why don't we show the trailer so everyone can have an idea what the movie's about?
Okay.
Okay.
Great.
We're very privileged in Canada.
Our healthcare system is great.
If it wasn't for Canada, I'd be dead man.
I had surgery on my shoulder. Well, I was on a waiting list for about a year and a half.
My husband did have to wait for 13 months to do a knee replacement.
I had to wait 7 months for an MRI.
It's the point where I'm spending $700 or $800 a month out of pocket.
What do you know about Canadian healthcare?
Very little.
We have a shared history of the development of our healthcare services. In both countries up until about 1950, we had pretty much the same system.
How's your healthcare system work for you?
Lousy.
And how do you feel about your healthcare system?
I think it's wonderful.
I can't say enough good things about it.
I just thank God every day that I am a Canadian citizen.
Happy to be here.
I'm very lucky.
We are blessed.
Every time that I've absolutely needed healthcare,
Because of our
We've had
prefer the
excellent
Canadian
experiences in healthcare.
Canada, I'd be dead man.
I'm very pleased. I would choose the Canadian system.
I really like the healthcare system.
All in all, it's pretty good.
I have nothing but praise. How has the Canadian healthcare system treated you?
Well, we're still alive. I think it's the result that counts.
Madam Speaker, this is not the President's house. This is not the Democrats' house. This is the people's house, and the American people don't want a government takeover of health care.
If the system is so bad and we're all so strongly supportive of it, you must think we're really stupid.
The real healthcare crisis is in public confidence and understanding, not in financial sustainability.
Great. Well, it was nice that you filmed so much of that here in Portland, Oregon. That's always a nice surprise. But beyond that, it really points out the Canadians really like their system.
Yeah.
And
Definitely.
that if you did that same kind of survey of Americans, I would guess that most Americans would say no, they don't really like their system.
Yeah, I think you're right. And if you asked if they thought that Canadians like their system, most of them would say no, because they don't know. And that's one of the myths that is that. I guess there was a study done right when we were making this movie. I think 85% of Canadians said that they appreciated the service that they were getting from there, and that's not known.
Great. Okay. Yeah. And Canadian healthcare is a single-payer healthcare system. Is that right?
Yes. So,
okay.
well, we learned a lot when we made this film, and even though I grew up in Canada, I didn't know a lot about it. I just knew that I had it. But what we learned was, the way that it works. And basically, people pay taxes like we all do.
If you think corporations bought free speech before, now that they're human,
Welcome to the Alliance for Democracy's The Populist Dialogues. I'm your host, David Delk. I'm president of the Portland chapter.